Presentation back up there. Okay, so we're going to take a look now at post-acute sequelae of COVID, what's referred to as PASC, long COVID or long haul COVID. We have a growing, unfortunately, we have a growing body of experience with these kinds of patients. Not quite as many as we've treated of the acute cases, but some patients who really have had, it's shocking to me actually how long they can persist. Even under good care, it can be very challenging to help these folks. So just a couple of background things, you know, the estimates range. Some people say as low as 10% of patients, some people say as high as 30. Who knows? And we probably won't know really until years from now how many people actually have had these symptoms. The Center for Disease Control in the United States says basically if symptoms persist for more than 4 weeks, they consider it to be a long COVID. The symptom range is absolutely massive and basically reflects a lot of the symptoms that we see in acute COVID. So fatigue, brain fog, loss of taste and smell, shortness of breath, cough, the list goes on and on. Many of these things are things that patients had right at the beginning of their illness and then just continued to have for long periods of time. In some cases, we've seen patients get sick, appear to get better, then get sick again. The variability is quite significant, and unfortunately, the testing is. I wish that we had a more accurate way to know for sure what we were dealing with. But anyway, we have what we have, so. Let's take a look at a couple of cases, and then I'll try and stop so I can leave some time for questions. So this is a patient, is a 54-year-old woman. She's quite healthy, very active. We saw her on January 14th for complaining of flu-like symptoms. She had not yet received a positive COVID test at that time, although she suspected. She did get a positive test later that week. And at the onset, she had body aches, sore throat, chest congestion, and eye pain, which is something that, that can be a feature of COVID. When we saw her, she was mostly complaining of chest congestion, a cough with productive that had mucus coming out. She was very fatigued, lethargic. She had a frontal headache. She wasn't really sure about her temperature. It seemed a little bit off, but she had, oddly enough, right when she got sick, they lost power in her neighborhood. So she had no heat in her house. So she wasn't sure if she was cold because of that or because of being sick. Anyway, so that was a little confusing. She seemed to have increased thirst and increased urination. Her appetite was irregular, and at that time, she had not lost her sense of taste or smell. We viewed her at that time as having an exterior wind damp, so we gave her Hwaseong-jeongchisan. This was given to her as an extract. This is a pretty straight ahead formula. It's not modified except for the last 3 substances that are up there. Bai-Qian, Sinanchi, Stamona Bai-Bu, and Asteris Ziwan. Those last 3 substances are part of Jersosan. So this kind of trying to transform the phlegm in the chest specifically and deal with the cough. We gave her this formula at a dosage of 5 grams twice a day, and we saw her again in about a week. she reported that she felt like more stuff was coming out via her nose. I think we generally took that to be a reasonably good sign that stuff was actually coming out, although the cough and the chest congestion was not much better. Sore throat was better. She still reported body aches and headache. She also started to report a little bit of ear pain, and her fatigue, though, was less, and her smell had gone away. So she did not have fever or chills. Her bowels were fine. Her tongue was enlarged with red sides and a white coat. I have to say that at this point, I started to be concerned that we were not quite getting a handle on her. And I'm offering this case in part because I don't think we did a very good job with her. And I want you to see that too. I don't want to be sitting here and telling you, oh, here are all these wonderful cases we've treated. We never had any problems. We never made any mistakes, and we never had any trouble, because that would be a lie. And I think that we can learn a lot from looking at cases that didn't go as well. And I think this probably qualifies as that, because she is a patient who we saw right at onset, and she basically became a long COVID patient. So we were unable to stop her from becoming a post-acute patient. Although, you know, we did eventually help her, and you'll see that. But so we continued on the Huashan-Zhengqi-san as a base formula, but we added more to try and clear the phlegm and the nasal congestion. So we added trichosanthes, gualo, we added magnolia, xinihua, we added qianhu, which is another way of trying to get at this opening of the chest and stopping the cough and the congestion. And she had been taking an herbal supplement unbeknownst to us that she reported to us on this second visit. She was taking something called ashwagandha, which is, I think, an adaptogen, comes from the Ayurvedic tradition. We asked her to stop taking that because it just was confounding for us what was already a complicated case. We saw her again then on the 25th. She was improved overall. She was still fatigued. She still had a cough, but it was more mild, and there was a little bit of yellow phlegm. And she had some GI issues, a little bit of nausea, occasional diarrhea. Ear pain was better, mostly just was a feeling of pressure. She also reported that her temperature was pretty neutral at this stage. This is where I think we made a mistake, because we gave her, well, I'll show you the formula we gave her. We gave her 6 gentleman decoction, Liu Junzitang. We added to it Chaihu and Baishao. And the reason that we did this is because our diagnosis at this stage was, we felt that, let me just go back a slide. We felt that at this stage, the exterior contraction was gone. The phlegm had mostly transformed, and we felt like we were mostly dealing with the lingering effects of dampness on the middle burner, causing a weakness of the middle burner qi and some lingering phlegm and lingering qi stagnation as a result of the presence of that phlegm. So we gave her this formula. And I think the mistake that we made was we tonified her too soon. And what I'll tell you is that it's not that she didn't do poorly. She just didn't resolve. So we went along with her all through February of that year, this past February. And she was kind of like better, but not better, resolved mostly, kind of, but not all the way. She didn't have like a big exacerbation of her symptoms. She just didn't get all the way better. And so I'm going to just go to the end. In March, she now is reporting she's feeling much better, but she still is occasionally having incidents of fatigue and discomfort in her lungs. And her bowels are still inconsistent. And so what we ended up doing, which was the thing that kind of finally got her over the hump at the very end, was we gave her this combination of Jurso-san, again, with Buzhong-ichi tang, with tonify the middle to augment the qi decoction, which is a Huang qi-based formula. But we also used a large dose of Danshen salvia and Dilong, the earthworm. So this was a messy case. And the patient now at this stage is doing quite well. She does not consider herself to be sick anymore. She's been discharged from care. We're not giving her herbs anymore. But, you know, we saw her early January and really didn't finish with her until the beginning of, what was that? The beginning of April. And so January, February, March, it has 4 months almost, or 3.5 months. And very not clean, but real. That's what happened. So let me show you one other COVID post long haul case, which is has a little different feel to it. And then I'm going to stop and take your questions. This was a 43-year-old man. Now his case is weird because he got sick with acute respiratory symptoms believed to be COVID in January of 2019. He was actually in London at the time. He recovered, then got sick again in March. Then in May, he had this significant respiratory distress, lost his sense of smell. And in July, he was actually hospitalized due to respiratory distress. When we saw him, he was complaining of chest tightness, shortness of breath, difficulty getting a full breath. He also was telling us, he said, you know, I have a history of asthma since childhood, but it's like, this feels different. And the normal medications that I would take are not helping. He was not coughing anything out. He had a little cough, but it was dry. He had an intermittent numbness in his fingers and toes, and he had constipation. So he had this dry, hard, small stool and abdominal pain. Poor appetite, but no nausea. Sometimes thirst, overall cold temperature, occasional headaches. Dusky tongue body, slight red tip, thin white coat, dark and distended sublingual veins. So we looked at the tongue, we looked at the chest tightness and the constipation and said, this is predominantly a lesser yang pattern. Gave him minor bupleurum decoction. We added some things to clear the lung, Shingren, Armeniaca, Jiegung, Platycodon, Trichosanthus tianhuafen to transform phlegm, but also Jurshur to help move the bowel, and Persica tauren for the chest and the blood stasis, but also to moisten the bowel. 5 grams, 2 times a day of this formula. This is December 10th, that should be, I think, 2021. Oh no, that would be 2020. He was not seen in December of 10/20. That's a error, sorry about that. Fewer episodes of shortness of breath, less intense episodes, and his bowels were becoming more normalized. Fewer episodes of abdominal pain and less intense episodes. Energy better. Tongue looking pretty good, slightly darkened distended sublingual veins still. So we more or less said, we like the direction this is going. We think this is good. Going to mostly keep him on the same thing. We took out the trichosanthus, but otherwise the formula is the same. Continues on this formula, and we see him again at the end of December. Breathing is better, but he's had a little bit of a return of the constipation, although no abdominal pain. He's doing better in terms of activity level. He's still a little thirsty. Tongue looks pretty normal, although still some dark sublingual veins. So the way that we looked at this was we needed to open the lungs and work more directly on the qi dynamic and not so much on the lesser yang anymore. So what we did is we gave him a modification of a formula called Sinisan, frigid extremities powder, but it's very modified. So instead of using Chaihu, we used this substitute that I talked about earlier, the Cyperus Xiangfu and Inula Xuanfu Hua, to help with the liver and to help with the lung. We kept the Xingren and Taoren combination, as well as the Jiegung, the platycodon. He did very well on this formula and was early, let's see, that was December, January. He kept taking herbs through January, through February, and we saw him for the last time in the middle of March. I would say that he stayed on herbs longer, not longer than I would have wanted him to, but he felt like the herbs were still helping, and he wasn't really ready to stop them, and he was doing quite well. I will mention towards the end of the treatment, the only thing that we changed, I'll show you this last formula. We did add some more direct tonification of yin and blood with the Ophiopogonus and Rehmannia. But basically this kind of Sinisan modification was what he took through those last stages. And when we saw him in mid-March, he agreed that he was ready to, he was going to finish these herbs and just be good to go. And so at this point in time, you know, in February and into March, he was playing soccer and running around with his son and like doing all these things that he had normally done and feeling great. So he was continuing on the herbs because he felt like they helped regulate his bowel and they helped regulate his breathing. And a little bit he was, and I've found this with quite a few of our patients, they're a little nervous to stop herbs because they've been helpful and they feel a little bit like they don't want to relapse. So, so that's the end of my slides. And I'm going to stop my screen share. And I guess ask, it doesn't look like anybody sent me messages during the lecture with questions. So I'll just ask now if there are questions. And the only person who's excluded from asking questions is Nadav, because I've known him for many, many years, and he's likely to ask a question that I can't answer. So, but anyone else who has questions, I'm happy to tackle them. So, are there any questions? Have I just overwhelmed everybody with information?
Yeah.
First of all, I think most of the people are very tired, and we have some alarm during your lecture. I don't know if you saw that some of us disappear.
Yes, of course.
So unfortunately, the situation. But I would love to ask you a question.
Please.
Does this post-corona symptoms remind you some other chronic viral disease, I don't know, maybe like Epstein-Barr or stuff like this.
Mm-hmm. I think that makes sense, Yaniv. I think in some ways similar. Certainly the fatigue and the body aches and the impact on multiple body systems are certainly very reminiscent of that. It's also interesting to me that I have seen some of these long COVID patients actually get vaccinated and improve. So the question of what exactly that means is unresolved, and I'm not sure, but I do think that some of the approaches for worm disease conditions, and especially worm disease conditions that have a lurking pathogen involved with them, are absolutely applicable to these kinds of long-term viral illnesses. And I think there's good reason to think that Epstein-Barr could be approached from a similar perspective. Yes.
And it was very interesting that you mentioned that you are not using all the classic formula, which I thought that you will use at the first stage, like all the Ban Langen, Daching Ye, Chuang Xinlian, Jinin Hua, and maybe Jinin Hua you mentioned, but so it was a bit surprising for me that you are not using those formula basically, because it's as far as I know, because I'm not a classic TCM, it's the classic formula for those situations, at least at the beginning of the treatment.
So maybe we have a slightly different understanding of the way that those herbs work. So when we talk about Ban Langen, Daching Ye, Jinyin Hua, Lian Chao, these are Chuanxin Lian. These herbs are cold and bitter, especially Ban Langen, Daching Ye, Chuanxin Lian.
Sure.
And they are so I guess my read on this is the reason that people in modern practice have an association between Ban Langen, Chuanxin Lian, Daching Ye, and externally contracted illnesses is in large part because research coming out of China suggests that they're antiviral, not because they were traditionally used for early stage illnesses. So, I mean, yes, Yin Chao San and Jin Yin Hua and Lian Chao are used for early stage illnesses, but the really cold, bitter ones like Ban Langen, Chuanxin Lian, Daching Ye, those are, in my experience, I don't usually see patients with early stage upper respiratory infection kind of problems where from a traditional point of view, I want to give them cold, bitter herbs. So it's maybe just a difference in perspective. But we definitely have not seen patients where we thought that was appropriate.
Yeah,
even though we've seen some acute stage COVID for sure. And it's not that we're using warming herbs. We might use things that are cooling, but it's a different strategy. Yes.
And Craig, how about combining such herbs with formulas like Xiao Chai Kutang or Bujong, or a combination?
So there are different perspectives on this, Nadav. And so that's not a strategy that I typically use, I'll just say, because it kind of goes back to when I think about the way that Xiao Chai Hutang works, there's a very particular balance between the bitter cold Huangqin and the rest of the herbs in that formula. And so if I were to add something like Da Qing Ye to Xiao Chai Hu Tang, my concern would be that I would throw off that balance and end up causing a pathogen to sink deeper into the body, particularly because in the case of Xiao Chai Hu Tang, we're already concerned about the kind of health and well-being of the jiangqi and the middle burner, and those herbs are hard on those areas. So, you know, this is one of those classic things, Nadav. I'm sure, I mean, I'm guessing that you're asking this question because you do that. And you probably find it helpful. So that's cool that you do that and find it helpful. And maybe I'll have to try that sometime. It's just not the perspective that I usually take.
I want to share with you something that I do quite often. It's not with the COVID, but mainly with patients, oncology patients. We manufacture a bujong ichitang in a kind of a unique method that the herbs are first soaked in alcohol and then cooked in the alcohol. So it's first creating kind of a tincture. And I think that my inspiration for that method of preparation is from the book Pauge, the French guy.
Philippe Ciano.
Yeah, exactly. I think that at the very beginning of the book, he's comparing between bujong-based alcohol or not based alcohol. And what I've so extremely effective with patients who are going through chemotherapy and their blood counts, for example, are going dramatically down, is combining this formula, the bujong, based on this special method of preparation, which I think is quite unique, and Yaniv's company is preparing it. And we combine it with a formula that has inside Chuan Xin Lian, Da Qing Ye, Banlangen, Chai Hu, and I probably forget one or two herbs. Let's say on a 50-50 ratio between these two herbs, and a massive dose daily. It can become like if you'd compare it to what in China would consider to be a bag per day or something like that. But you see a dramatic increase in level of white blood cell count, for example. Though COVID is not chemotherapy, there is something in the drama and the extremity and the acute level of that people are going through that I thought of using these combinations. It depends also how severe is the case, how acute is the case, if the very beginning level of the case.
Cool. Thank you. I that's really interesting, and I
etc. And as you said, I think that maybe we will share with you these two formulas and the method of preparation and something like that. It will be interesting to discuss it.
Absolutely. I mean, that's a beautiful thing about Chinese herbal medicine, as you well know, Nadav. I mean, you try something and you see how it works, and if it works, then there's really nothing anyone can say about it, right? Whether or not it's in line with traditional thinking or not doesn't really matter. So that's cool, and I'm glad that you've had success with that. I want to just answer one of the questions that I just got in the chat. So the question was, do all the cases mentioned in the research study, do they overcome COVID-19 with no need to get the vaccine, or was it just designed to help them with the symptoms of COVID-19? So one of the things that we have to, in the United States, we have to be very careful about, because we're not Western MDs. We're actually restricted kind of in the language that we use. So what we talk about is that we are addressing the symptoms of COVID-19. And we definitely have encouraged our patients to get the vaccine when they have the opportunity to do so. We we are focused on the symptoms when we talk about these things outward facing. So when we discuss this with patients or when we discuss it with other practitioners, either Western or Chinese trained, in my own mind, I think that we are addressing COVID-19, but what we need to say is that we're addressing the symptoms of COVID-19. So,
question of terminology and regulation.
Exactly. Exactly.
Okay.
Yep.
We all have to deal with it. Yeah.
Yes, exactly.
So, Eli is asking, I'll try to. Okay, so Eli is asking, how can you know if the patient already passed the first stage of the COVID and the pathogen went out? I think that this is the question. I hope you understand.
I'm not completely sure I understand, but if I could, I mean, one thing I could say is we look for evidence of symptoms that the exterior is still engaged. So certainly if the patient still has fever or chills, those are indications that the pathogen is still at the exterior. If those, you know, once the fever goes away, which for some of these patients takes a long time, but once the fever goes away, we tend to think that the pathogen is getting deeper into the body. And that might be deeper just to the level of the lesser yang, or it might be deeper as in some other place inside the organs. So I mean, it's really just based on a symptom analysis. We also, I would say, as the tongue changes more significantly, that also can give you some clues, because oftentimes in the early stages of the illness, you don't see a huge amount of change necessarily in the tongue. And as the tongue coat gets thicker, or the tongue body starts to change more, or the sublingual veins start to get darker or more distended, that's also evidence that the pathogen is going deeper inside the system. I hope that answered the question.
I hope so. Okay.
Any other?
Yeah. So thank you so much, Craig. It was a big pleasure, and I really enjoy. And I hope that next time we'll be in Israel and in better circumstances. So
I hope so too.
Yeah, it's a crazy situation. But yeah, thank you. You keep me awake, and these 2 crazy days, it was really strange, but
yeah,
you learn something new every day.
I hope everyone stays safe there, and I thank you again for your invitation. I hope that that it was useful to people, and I'm certainly open to getting feedback from folks, or if you have questions that come up as you're working with patients or thinking about these things, I'm happy to field questions. In fact, I will give you all my email.
Because it was a very intense conference, we told all the participants that they don't have to watch live all the lectures. So there are maybe another 80 participants that will get the conference on a link.
Okay.
So I guess in the coming few weeks, you will have some questions from people that didn't see the lecture. So get ready.
Okay. I really genuinely, I'm happy to answer questions. So please be patient if you email me. I have a lot going on in my life at my school and with my patients myself, but I will get back to you, I promise.
Oh.
And I just want to also just end by saying what pleasure it is to see your face, Nadav. It's been too long since I've seen you.
Way too long.
And I hope that we do get a chance to visit together in person sometime soon.
Thank
See
you.
you soon. I really hope to see you soon and give you some hard time.
Yes, as always.
As
Okay.
always.
Stay
Good
safe,
night.
everyone.
Thank you.
Good care. Bye-bye.
Have a good night.
Bye-bye.
טוב, אני לא מאמין שעברנו את ההרצאה הזאת, אצלי לפחות רק עם הזקה אחת. אז לכל מי שעוד שרד פה ונשאר, אני רואה 26 חבר'ה שרדו, זה כולל את המפיקות הנפלאות ואת המתרגמות. אז קודם כל תודה, כמובן אני עוד יוציא תודות לכולם, אבל קודם כל תודה לכל המפיקות, לבלה ולמיכל ולכל המתרגמות, מיכל והאחרות, וכמובן לשיילי המפיקה של הכנס. באמת היה מטורף, אני מודה שאני כל הזמן ככה עם הטלוויזיה בזווית עין מסתכל ככה מה קורה, הזקות וכדומה, והילדים שלי פה בבית, ויומיים פשוט לא הגיוניים בעליל, רק בישראל מה שנקרא. איכשהו ההרצאות האלה פשוט העסיקו אותי והעבירו לי את הזמן. אני שואל את עצמי איך היו עוברים היומיים האלה בסיטואציה רגילה. זהו, זה פשוט משהו מטורף, אני מעריך שאני אזכור את היומיים האלה בטח כל החיים שלי. אז קודם כל תודה לכל מי שהשתתף, ואני מזכיר לכם, אתם תוך שבוע 10 ימים אנחנו נערוך את כל הכנס, וגם התרגום יעבור שפצור, ותקבלו את ההרצאות דרך לינק. זהו, אני מאוד נהניתי, אני מקווה שהפקתם תועלת לפחות מחלק מההרצאות. זהו, תודה רבה לכולם, ובאמת שיעבור ערב בטוח על כולנו, ושהמצב יחזור לשגרה בהקדם ונחזור לעיסוקים הרגילים.
יניב?
תודה לך.
כן.
יניב, זאת שיילי. רציתי להגיד לך תודה על כנס מדהים שהרמת עם כל המרצים המדהימים שהבאת, וכל הכבוד, ואני מקווה שכולם נהנו, ולילה טוב גם ממני.
לילה טוב.
נהדר. תודה רבה חברים.
לילה טוב חברים.
להתראות.